In this paper, we present an automated triage in pandemic support vector machine for efficient patient classification. During the pandemic, medical resources were overloaded all over the world. This study focuses on developing tools to alleviate this burden for the attendants and improving the medical care. We introduced an approach using support vector machine models to replicate the COVID triage process based on patient-provided information and not on laboratory tests. The main goal was to improve conventional triage methods by integrating machine learning with medical expertise, improving the accuracy and patient outcomes in high-demand situations. The hospital Dr. Bernardo Sepúlveda attended 9,609 patients from April 2020 to February 2022. From those patients, 1,834 patients were admitted to hospitalization. Due to the lack of early global triage guidance, a specific COVID triage was developed by the emergency department of the hospital. The COVID triage was designed with only 3 classifications: green, yellow, and red, to facilitate the learning process of the triage personnel and the system's interpretation and use. The criteria to classify the patients were divided into major and minor criteria. Each one had a specific score that can be seen in the following table. A computer program was designed to record this information and to automatically calculate the sum of COVID triage scores to assign the correct triage color. If the sum of all criteria was 10 or higher, then the patient was classified as red. If the score was 6 to 9, the classification was yellow, and 5 or fewer points was considered green. Nevertheless, the physician had the authority to modify the classification color because they can assess situations holistically and draw on past experience to identify patients that might worsen their condition soon. In order to generate a classification structure, 3 support vector machines are proposed, such that only uses data obtained from self-evaluation from the patients and not requiring clinical data to assign them to a triage group. Success rates of triage classification for green, yellow, and red categories plotted on the y-axis with error bars representing one standard deviation. The x-axis indicates the increasing fraction of the total number of patients used in the training process, with a remainder of the data reserved for testing. It can be seen how just over 3% of the total patient data utilized for training can provide a success rate of more than 98% for both green and red triage classification. This shows the model efficiency and robustness in accurately classifying patients with minimal training data. At the onset of the COVID-19 pandemic, emergency services worldwide were already facing critical levels of saturation. Conventional triage processes, which typically rely on quick assessment to prioritize patients without aiming to diagnose, were insufficient facing a novel spreading virus. The excessive workload of medical staff was a factor associated with suboptimal medical decisions. The support vector machine's analysis capacity is more accurate and rapid than the physicians examining all the patient information and making decisions under the pressure imposed by the pandemic. The support vector machine triage system presented in this study demonstrates promising potential for improving emergency department triage processes by automating patient classification based on provided information. The system showed a success rate of over 98% for red triage classification using under 2.8% of the total patient data. The system's integration with clinical expertise ensures that it improves rather than replaces the clinician's role in the patient's care.